Hi everyone, Scott here from BetterHealthGuy.com. Thanks for joining me for another Better Health Guy blogcast. Today's topic is restoring your health from Lyme disease. First, I want to say that everything in this discussion is for informational purposes only. No comments are intended to diagnose, treat, or cure any condition. As always, discuss any potential health-related decisions with your own personal medical authority. Today, I'm honored to have Dr. Bill Rawls on the blogcast. Dr. Rawls was diagnosed with fibromyalgia in his mid-40s and developed insomnia, fatigue, joint and muscle pain, and eventually chest pain and heartbeat irregularities. As a doctor, he searched far and wide within the conventional medicine realm, but nothing added up. He then began to search outside of conventional medicine and towards health restoration. He became vigilant about his diet, adopted a moderate exercise program, meditated, and learned yoga. He also began to experiment with herbal supplements known to have restorative properties. This approach worked, and he began to get his health back, until he was bitten by a tick and developed Lyme disease. He then learned about herbal protocols for combating Lyme disease and began to feel human after a few months of using high-dose herbs. He's continued his exploration and is doing very well today, and I'm excited to have him here with us. As someone who understands the misery of chronic Lyme disease firsthand and has a background in medicine, Dr. Rawls offers a unique perspective. Dr. Rawls will be sharing his journey in detail in his new book, Unlocking Lyme. Welcome, Dr. Rawls.
Thank you, Scott. It's a real pleasure.
It's a pleasure to have you here as well. So tell us a little bit about how your Lyme journey first started, how Lyme first impacted you, and kind of just fill us in.
Yeah, that tick bite you mentioned, I consider the second tick bite. I grew up exploring the woods, building tree houses my entire youth and tromping around in woods for everything. So tick bites were just commonplace. They were every day. And I think I probably had the microbe in my system for a long time, but ended up with a chosen career of obstetrics and gynecology, which required call every second or third night. And I was one of those people that if I had someone in labor or somebody that had some concern going on, I was awake. So I spent 15 years sleep deprived. And eventually it caught up with me. I think that was a factor that suppressed immune function, and gradually I got worse. I chose fibromyalgia just because I didn't know what else it could be. And I had done a Lyme test, and it was negative. But retrospectively, all the symptoms that I had after that second tick bite were essentially the same things that I had been experiencing. And I really felt like I had Lyme disease all along. I probably contracted the microbe early in life. And it wasn't until I just really trashed my immune system before I started having the outward symptoms of Lyme disease. And I think that's a story with a lot of people. Most people don't remember that tick bite.
Right. Yeah, and it's amazing how much stress is the thing that kind of then leads us towards the symptomatic presentation. I think we can manage a lot of these things until we're under significant amounts of stress. I totally relate to that. So let's talk a little bit about some of the ways that people may get exposed to Lyme. So you mentioned tick bites. Are there other ways that you think are possible exposures for people?
I think tick bites are the most common way. There is evidence, I found studies that I cited in the book that Borrelia, the microbe that's typically associated with Lyme disease, can be carried by mosquitoes and a variety of other biting insects. But when you look outside Borrelia and Mycoplasma and Bartonella and all of these other things, there are just lots of ways that we can get microbes in our body. And basically, they are trying to do that all the time, every day. So kissing a person, hugging a person, any kind of contact, bug bites, things you eat, things you drink, all of those are opportunities to get microbes in your system. And which route the microbe chooses has been defined by the specialty of that microbe over thousands and millions of years.
Absolutely. So, given that most of us probably have been exposed to various microbes, with Lyme, do you think that it's the Lyme-related microbes themselves that are causing us to feel poorly, or is it something more unique in terms of how we respond to or react to these organisms that's really the differentiator?
Yeah, I think that there's fairly good evidence that when you look at the spectrum of microbes associated with Lyme disease, these things are fairly low virulence. They are not affecting our bodies in a way that something like Ebola might. It's a low grade illness, and so these things are occurring at low concentrations in the body in very isolated regions of the body. It's typical of these microbes to be able to infect and live inside cells. So concentrations of the microbes are very low. And Borrelia doesn't have a gene coding for a toxin that hurts us. So basically, the strategy of these microbes is to manipulate the immune system to generate inflammation, to break down tissues so they can have resources and nutrients that they need. So with Borrelia, the prime nutrient is collagen. So the symptoms are going to be found in collagen-rich areas: joints, brain, eyes, skin. But it's hard to find it because the microbe itself is in very low concentrations. So when you have this huge immune response, this tug of war going on between the microbes and the immune system, it's actually that reaction that's causing most of the symptoms.
Yeah, thank you very much. Therein the reason that I had collagen this morning in my power shake.
There you go. Right.
So,
Absolutely.
why would you say that Lyme disease is such an issue now compared to in the past? I mean, what really has changed in our world and our environment that's made it such a bigger problem?
Yeah. That's a point that I wanted to get across in the book, that when you look at the history of Borrelia, they found the Borrelia microbe trapped in amber from the Dominican Republic dating back 15 million years. And there's some speculation that Borrelia was probably infecting dinosaurs. It's a really, really ancient microbe. And so when you look at the fact that it's been around a long time, it's been infecting humans for a long time. That relationship between the tick and Borrelia is ancient, millions and millions of years old. And because ticks have been biting humans since there have been humans, and ticks have been carrying Borrelia since there's been Borrelia, you got to assume that ticks have been biting humans for a very, very long time. So that relationship is very, very well established. And the more a relationship is established, the less in the way of symptoms it's going to cause. The problem, so humans have always been affected by Borrelia. This isn't a new thing.
Okay.
But I think that the issues that are going on now is I think that people are more aware of the illness. In other words, before, say 1960, we didn't really recognize chronic illness the same way that we do now. We treat the medical system treated acute illness. And some people were just sick. And there were a lot of people out there that were sickly. My grandfather was a general practitioner, and I can remember people coming to the door and complaining about all these aches and pains and everything else, and he really didn't know what to do for them and gave him a B12 shot, So it's so they probably have been there for a while, but we are just starting to become savvy enough to recognize this as a problem. The other factor is I think people are getting more ill from Borrelia and these other microbes than they used to because of the way that our world has fallen together. We have a lot of the factors that affect the immune system. And these factors weren't present 100 years ago. If you look back at 1900, people were dying of trauma and infections with catastrophic microbes like pneumonias, but they weren't dying or getting ill of the same things that we are today. So if you look at what we eat, the toxins we're exposed to, the just low-grade stress that everybody has in their lives, the fact that we all sit, we don't really get out and exercise, we're surrounded by electromagnetic radiation. All of these factors are affecting our immune system. So I'm coming to believe that we're really living in the age of chronic immune dysfunction. Mm-hmm. So we're going to see more Lyme disease and fibromyalgia and chronic fatigue and different kinds of autoimmune diseases. They all have that same foundation and that chronic immune deficiency that's affecting everyone on the planet so much right now.
Yeah, I think personally I'm very interested in how chemicals and pesticides and all of those things affect our immune system. And I know in your book, Unlocking Lyme, you talk about the modern world and what you call system disruptors and how those lead to immune dysfunction and ultimately a state of dis-ease. And so you mentioned a few of those. Any other comments you want to share about those system disruptors that we might need to be aware of?
Well, this goes back to my searches in the very beginning of why I was ill in the first place, and before I really understood Lyme disease the way that I do now. I was in conventional medicine, we do a really good job of treating acute illness. And still, if you break your leg or have a heart attack or an acute pneumonia, America is the best place in the world to be. We're going to really jump on it and do a great job with that. But when you look at chronic illness, we have this approach of treating things acutely, and we try to apply that acute approach to treating chronic illness. We use drugs to treat the processes of the illness and the symptoms of the illness acutely. So you have to keep taking the drug every single day for it to work. And we don't really look at that concept of wellness. So if you ask the question, how do you restore wellness? What causes the illness? Then you have to look at the chronic illness as in a whole different light and look for the causes. And we do a good job with that with acute illness. Somebody has a broken leg, the cause is obvious. But the causes of chronic illness are more complex. And so through my searches, I looked for categories of things that would fit together that would in some way affect disease. And I came up with 7 categories of things. And interestingly, I found these things in an old biochemistry book that I had from college after I had, spent so much time figuring it out. So it's not new. It's just, we're not paying attention to it. But food, processed food, toxins, mainly petrochemicals and from mining, that has only been going on for the past 100 years. The emotional stress that comes with just living in the modern world, which can be really oppressive to all of us. Physical stress, you can overstress your body, but most people are understressing their body. We sit, and you need exercise to generate endorphins and stem cells and natural killer cells and help glandular functions work. And we don't do that enough, and we don't do it in the right way. Electromagnetic radiation, that one's a little harder to put a finger on, but we're exposed to a lot of unusual and unnatural radiation now. Microwave towers, the devices that surround me right now, how much of effect that is, it's hard to quantitate, but it's real. Oxidative stress is the free radicals. When your cells, when they generate energy, a byproduct is oxygen-related free radicals. That's very damaging, and in our diet, we're not getting enough antioxidants to protect us. And then inflammation is really a form of oxidative stress. White blood cells generate inflammation or generate free radicals to kill microbes and that sort of thing. And so the last category is the microbiome, disruptions in the microbiome.
Mm-hmm.
And that can be because of these other factors or microbes entering in the system. But I found that it doesn't really matter what disease you want. You can apply those principles to any disease process. And it's what disease someone ends up with depends on their genetic makeup, how those system disruptors come together in their lives, and what kinds of microbes they've been exposed to through their lives. Mm-hmm. And that's the foundation of the whole thing. And so when you start looking at disease from that point of view, you really turn your whole strategy for getting well upside down and approach it from a different direction.
Yeah, I totally agree, and I think people will learn a lot from the detail that you went into in the book around the system disruptor. So that was a great overview, but there's lots more to be learned. So thank you for that. So I know that Stephen Buhner was one of the reasons that you started personally kind of exploring the herbs. So how has his work and his teachings influenced what you're doing?
Yeah, I consider him a pioneer in not only Lyme disease treatment, but also in what I would define as modern herbology. He has stepped out to do something a little bit different, which I think is extraordinary. By the time I read his book, I was exploring herbal therapy. I was certainly affecting lifestyle, diet, a lot of different kinds of things. But I read his book, and his explanation of Lyme disease at that time in 2005 was extraordinary. And he taught me something really important. But, before then, I had been using herbs like I'd been using drugs. And I think a lot of people have this approach that, wow, a medicinal entity has potential for toxicity, therefore you use it by itself, isolated, lowest doses possible. But when you look at herbs, they're not, it's fundamentally different. The herbs have chemicals in them that the plant is using for protection. So it's a wide spectrum of antimicrobials and all kinds of things that are there to protect the plant for the same stress factors that we have. So and humans have been using plant medicine for so long that we naturally do well with most herbal therapy. So when you look at using it as a medicinal, you need an orchestra. You need all of the herbs together working synergistically, and you need the right doses. And that's what I learned from Stephen Buhner. It's not one herb at one time for one thing. It's a spectrum. It's an orchestra of different herbs in a dose to create a synergy that's inducing the healing, suppressing the microbes, boosting the immune system, reducing the inflammation, all of these things all at one time. And that's extraordinary. Another thing Stephen Buhner has done is he's not defined himself as a specific type of herbalist, which I consider something that's happening, not only Stephen Buhner, but others out there are starting to embrace all the different herbs from all of the herbal traditions. And instead of looking at the traditional way of use, respecting that, but looking at the causes of the problem, what from a little bit more of a scientific approach of what's the cause and how can we use the spectrum of biochemical substances within herbs to gain benefit and help restore normal in the face of that problem. Mm-hmm. So his work, we're what I would call modern herbalism. We're not restricted just to Chinese herbs or just Ayurvedic herbs or just things from the Amazon. We're picking the best out of each of those traditions and using them in a way that's just fantastic. So there's just a huge amount of promise there.
Yeah, I totally agree. I'm a huge fan of herbs. I've had the blessing to have met Stephen a couple of times, and he, besides just being brilliant with the herbs, he's just the kindest, gentlest soul that you probably ever will meet. I mean, just being in his presence, it's such a nice. He's such a nice, loving energy, which is really nice. So, what do you think about the idea that with herbs that we're probably supporting the body in so many ways and so many different types of microbes that are being addressed and so on that maybe we don't even know about today, that essentially their benefits go probably beyond what we really even currently comprehend?
Yeah, I think that's a key assumption that I think you have to make with these kinds of conditions. There's something called Koch's principles that go back to the 1800s, where looking at microbial disease, and it was looking at the concept that one microbe causes one disease, and you treat that microbe, and you treat the disease process, and that works with highly virulent microbes. Something like Ebola or malaria or an acute pneumonia with a highly virulent microbe, that principle stands to be true. And so treating that microbe aggressively, either with a vaccine or isolation in the case of Ebola virus or a synthetic antibiotic, those are appropriate therapies for those entities. But when you look at chronic Lyme disease, you're not talking about one microbe. I mean, more and more we're finding that people often have two species of Borrelia and different strains of Borrelia within their body, but never just Borrelia by itself. The mycoplasma is probably always there, or Bartonella, or chlamydia, or a wide range of things. In his most recent book, Stephen Booner cited one species of tick has the potential for carrying 237 different genera of microbes. Now, a genera is a family, so you're talking about one species of microbe can carry hundreds, possibly thousands of microbes that can infect vertebrates and cause illness. Mm-hmm. So we're just scratching the surface.
Yeah.
So when you try to apply that concept of, okay, Lyme disease is caused by this microbe called Borrelia, and we're going to treat this microbe with this antibiotic, and this person's going to get well, it just doesn't work. There are a lot of things on board. So when you look at plants, every plant is having to affect the microbes that are threatening it in its environment. So instead of making a chemical for a microbe, it's making a wide spectrum of things that affect many different microbes in different ways. So you take that plant that comes from that region or evolved in a particular region, and you combine it with other plants, you get this really broad synergy of antimicrobial coverage. No, it's not as potent as a synthetic antibiotic. Somebody comes in with acute fulminant pneumonia, I'm going to put them in the hospital and give them IV antibiotics, and they're going to be well in a week, because the concentrations of that microbe are very high. The microbes are growing very fast, and they're consolidated in one region that the blood supply can get to. So a synthetic antibiotic in that case is the right answer. When you're talking about Borrelia and the microbes that we refer to as stealth microbes that come with Lyme, you're talking about microbes that occur in very low concentrations in the body. They grow very slowly. Pneumococcal microbe will turn over a generation in 20 minutes. Borrelia, 12 hours. A lot of difference. Very slow growing. Isolated regions of the body, in joints, in brain, in places that it's isolated from the immune system and antibiotics, and it is able to live inside cells, which antibiotics don't get to as well. So synthetic antibiotics are going to affect the total microbiome and disrupt all the other microbes in the body before they're going to get to that thing. Mm-hmm. Whereas the plants are suppressive. They're affecting things in a way that it's suppressing. It's basically making life miserable for these microbes. But at the same time, it's boosting the immune system and reducing those inflammatory messengers that the microbe is using to get at resources. Mm-hmm. So it works. It just makes a lot of sense.
So maybe it's really the herbs that are man's best friend.
No doubt about it. Yeah. Yeah.
So talking about Borrelia, one of the things that you have discussed is that Borrelia isn't here to make us sick. So my question is, what does it want from us? What are its goals? And right. Do we essentially just need to find a way to harmoniously coexist with it?
I don't know if we want to coexist necessarily, but it is a fundamental point that I see so many of my medical colleagues have just missed. And that is, you have to ask why a microbe is behaving in a certain way, all right? So when you look at microbes that we encounter, they're all host dependent. They must have a host to survive. What does that mean? It means that the microbe can't live in free form. It has to be inside a host. It can be transferred back and forth between hosts, but it can't be outside of a host and survive. It has to have resources, food and functions from cells to survive. So it's very dependent on us to do that. All right. So every single microbe we encounter is host dependent. That's very important. So what they want from us is to survive. They want resources from our bodies. So to get that, they've got to get past our immune system, or either that or make a deal with our immune system so they can do that. Because we don't want to give our resources away. It's a give and take relationship. So how well that relationship is established depends on millions of years, thousands upon thousands of give and take between the microbe and a particular host. So how well adapted the host is to that microbe, how well that relationship is established, depends on where the receptiveness that we would have for that microbe. So with our normal flora, the thousands, the trillions of microbes that inhabit our body, that relationship is truly ancient. We have been doing that give and take. So those microbes are aggressive too. The biggest evidence of that is when somebody passes away, their body immediately begins to decompose. It's not bacteria from the outside that are doing that. It's your normal flora. They're not inhibited by the immune system anymore. But our immune system knows our normal flora. It knows their tricks very, very well. So we have this balanced relationship that we call symbiotic. And therefore, they get what they want. They even give a little bit back. And we have this comfortable relationship. At the other end of the scale, look at something like Ebola. Ebola is a virus. They are thinking at this point that the natural reservoir, because every host-dependent microbe has a natural reservoir that it has a normal relationship with. They think the reservoir is a spider that lives in an isolated area in Africa. And when that spider bites a bat, it infects the bats, but it doesn't cause them to be quite as ill as it does humans, because that's been going on more often. But occasionally those bats will bite or infect a human. So we've rarely ever been exposed to Ebola virus. We have no defenses for it. We have no way to compensate for the aggressiveness of that microbe. So when it gets in our system, it's devastating. It just tears us apart and then goes to the next host. So it's an imbalanced relationship. It doesn't work well for the microbe because it's killing off hosts so rapidly that sooner or later that's going to be contained. when you see an epidemic of a highly virulent microbe like Ebola, sooner or later it's going to burn out. Now, we've artificially contained that, and so it burned out a little bit faster, but even if we hadn't, it wouldn't be something that would cover the whole earth. It would burn out because it's an imbalanced relationship. So when I talk about that in terms of virulence, virulence is the ability of a microbe to cause disease. So our normal flora would be about a 1 on a virulent scale. Ebola would be about a 10 on a virulent scale. So it's an imbalanced relationship. So where's Borrelia in all of that? Borrelia is about a 3 or 4 on that scale. In other words, it's not, we have been exposed to it. We've been exposed to it for thousands upon thousands of years. But that relationship isn't quite comfortable enough for it to be a normal flora. I call it a normal flora wannabe.
Okay.
Because it's we know it, we've been exposed to it, we know its tricks, and if the immune system is really healthy, you keep it marginalized. And it doesn't cause any problems. And that's what happened to me. I think I had it in my system for years, and as long as I had a healthy immune system, I was okay. It's when my immune system just started to deteriorate that I started having problems. So Borrelia is this ill-fitting thing that it's not as virulent as a lot of other microbes, but it's not as comfortable as a host. And when you look at the numbers of those, there's high virulence microbes like AIDS and HIV and Ebola. We don't get exposed to them very often. But these things down around that 3 or 4 level where Borrelia is, we're constantly exposed to these things. Mm-hmm. And all they want is to use our resources and long enough for that next tick bite to come along so they can get on board that tick and go on to a next host. So they really don't need you. In fact, if you're deathly ill and in bed, you have messed up the microbe's mission, because if you don't go out and get bitten by other ticks, then that microbe hasn't had the opportunity to complete its mission and complete its life cycle.
Yeah. Very, very interesting. That's actually that's one of the things that I liked in the book too, the way you kind of outline the virulence pyramid, and it kind of conveys a different understanding and perspective. So it's nice to know that many of the Borrelia and co-infections are not high in that pyramid. So
yeah,
very helpful. So do you think that the goal of treatment is to get rid of every last one of these microbes with Borrelia and co-infections, or do you think we need to think about the idea of kind of ongoing maintenance treatment over a long period of time to minimize the chances that symptoms return?
Yeah. I'm not sure I have an absolute answer to that. If I could reverse it and get Borrelia and other kinds of things out of my system, I think I would. But quite frankly, here having perfectly normal health for 5 years and feeling great and feeling like I'm actually in much better health than a lot of people in my age, I can't tell you that I've eradicated Borrelia from my system. Again, I think these kinds of microbes, these things that are low down on the virulent scale, that are always out there trying to get on board and gather some of our resources, we all have them. There's very good evidence that a very high portion of a tested population any tested population will carry mycoplasma and chlamydia and Epstein-Barr virus, and we all are exposed to these things during our lifetime. Borrelia is probably a little more virulent than mycoplasma, but again, I'm not sure you can get rid of them. And there was an really interesting study last year that they took a selection of people from around the country. And the interesting thing about this study and this population is they picked individuals who had a negative Western blot for Lyme. They had symptoms of Lyme, but a lot of atypical symptoms. They had been treated by a physician with intravenous antibiotics for 6 to 9 months. And they took these people after the antibiotic therapy. These people were still symptomatic, even despite all the antibiotics, and they did blood cultures using a very special technique that takes a long time. It's not really practical for everyday use. In several of these people, they were able to culture not one, but 2 species of Borrelia. Native Western blot, treated with IV antibiotics for 6 to 9 months, and they still had it in their system. So that suggests that maybe our goal should be to just really strengthen our immune system, marginalize these things again, and restore health. So I can tell you, I'm not going to let my guard down again.
Right.
I eat healthy. I gave up the night call a long time ago. I really am very conscious of my stress levels, and I still take lots of herbs. I've been doing that for 10 years straight. But hey, here at age 60, I'm doing the things that I missed when I was in my late 40s and early 50s. And the really crazy thing is my joints are probably better than when I was in my 30s.
Wow.
I mean, I got my knees back, and I thought that hip that I thought was going to have to be replaced by the time I hit 60 is perfectly fine now. So I'll take my herbs.
I 100% agree. I continue also to use herbs for maintenance and don't plan to stop them. I mean, I really see them as food for the body. And I know that some people find the idea that maybe we don't get rid of every last bug to be kind of a stressful thought. On the other hand, I think we're exposed to things like, the kind of corollary of maybe the chicken pox virus that maybe someone got exposed to when they were young. They don't have symptoms for decades, yet maybe they get under a significant stress and whatnot. They develop a case of shingles. And so it's to me, it's kind of the same idea that it doesn't really matter whether or not there's a microbe left. It's more whether or not we feel good. So,
Awesome.
yeah.
Yep.
So let's get into some of the approaches for treatment. So maybe you can tell us a little bit about how you approach treating Lyme, what you found most helpful, what strategies do you think are really worth exploration?
Yeah. I think this is really important, and this is the one thing that I would do to change our entire approach to healthcare if I could do it. And I'm hoping that this book and other work that I do may be instrumental to that effect. I separate therapies, whether you're talking about Lyme disease or anything else, I separate therapies into 3 different categories: restorative, symptomatic, and heroic. And restorative would be everything that we've talked about so far. Enhancing the healing systems in the body, reducing inflammation with herbs, providing antimicrobial support with herbs, optimal diet, low stress level, plenty of good restful sleep, exercise that doesn't disrupt the body but enhances our healing systems. So that's restorative therapy. That's the foundation, and I think it's important for anyone. The second category is symptomatic therapy. There are a lot of symptoms, and especially symptoms of pain and poor sleep and other kinds of things get in the way. And herbs take a long time. The restorative approach takes time. It takes months, it takes years, and sometimes symptoms can get in the way. So treating symptoms acutely, sometimes with drugs, but there are also plenty of alternatives out there too, can help the patient's pathway to wellness by just getting rid of some of those obstacles that often get in the way. And then the last category is heroic therapies, are the things that those are the life-saving things. That's the therapy for an MI or a broken leg. Those are the things that, our whole idea behind a heroic therapy would be artificially disrupting the disease process. And sometimes that's appropriate, and it helps the body get back on its feet. And so they're important too. So I use a pyramid to put those in perspective too. The base of the pyramid is that restorative foundation. The second level is symptomatic therapies that you use mostly in the beginning, but need less as the symptoms are going away. And then heroic therapies when nothing else is working, or I use the analogy of a leaking dam. And if all you're doing is plugging the holes in the dam, that's what we're doing a lot of times with chronic illness. We're using heroic therapies. But if you don't go back and restore the whole structure, then you're not going to get ahead. But sometimes if the leaks are bad enough, you got to plug those holes acutely for the patient to move forward. So, but the heroic therapies that are at the top, and my experience has been that for Lyme disease, chronic Lyme disease, most people can do just fine with a good restorative foundation, possibly a few things for symptomatic. And it's only about a third of people that are going to end up needing some kind of heroic therapy. Things that I put in the category of heroics would be synthetic antibiotics, oxidative therapies, ozone, hyperbaric oxygen, those kinds of things. Rife machines probably go in that category. I didn't use a Rife machine personally, but I think they may have value. They don't replace that restorative approach, but for some people that can be useful. So I defined all these things in the book to put them in perspective. But I think one of the big problems in conventional medicine is all we do is heroic and symptomatics. We've ignored that whole restorative foundation. And unless we're doing things to help people with that, I think they're less likely to get well. So I think it's really important.
I totally agree. It's the disease model versus the wellness model, and there is a big difference between the two. Maybe you can tell us a little bit about some of the herbs that you personally have found helpful and why people with Lyme would be interested in those.
Mm-hmm. Personally, I started with Stephen Booner's work from his Healing Lyme book in 2005. And those herbs are still a great mainstay. Andrographis from Ayurvedic medicine, cat's claw from the Amazon, sarsaparilla from Amazon, but also species from Chinese medicine. Japanese knotweed has turned out to be a really nice general antimicrobial and supportive herb. And I added to that a stabilized garlic product that stabilized the acillin. Garlic is wonderful. It's just that as soon as you eat it or crush it, it's gone. But there are companies out there that have learned how to stabilize that volatile chemical called acillin. So it's not volatile anymore. So you get 100% use out of it. That's a really nice one. So that was his foundation, and I built on that. And since then, added a lot of the adaptogenic herbs, cordyceps, reishi mushrooms is a favorite. I try to stay with the non-stimulating herbs in Lyme patients. I know Stephen Booner uses a lot of Eleuthera. I found that it's just way too stimulating for people. So I've substituted in Rumania and Chinese skullcap is a good one. But wow, the list just goes on and on and on. I mean, we will never run out of great herbs. You know, if somebody, one of the things that I do now is we founded a company to use best quality herbal extracts and make it easy for people to take this just by putting it in formulas. But if somebody told me tomorrow, hey, you can't use any of those herbs anymore, you can't get them anymore, I'd say, fine, no problem. And I go pick a whole nother set. That's the cool thing. There's just so many great things out there, and we're just not tapping into the potential of these things like we should.
Mm-hmm. Yeah, I agree. It's reassuring to know that there are so many tools in the herbal world that apply really nicely to these kinds of conditions. Do you think that herbs work well for the co-infections like Bartonella and Babesia and those kinds of things? Is there anything that you haven't seen them be helpful for?
No, and I think you've got to do that whole approach. I mean, in other words, if you're just taking herbs, but you're not cleaning up your diet and you're still not sleeping and you're still not controlling stress, you're not going to get where you need to do. You need that comprehensive restorative approach, and herbs are a big part of that. Um, but it's but again, if you're focused primarily on restoring immune function, you're going to cover most things. Um, Not to say that there aren't cases where people have Babesia or Rickettsia, which are some of the more virulent things that are tick-borne, that they couldn't benefit from other therapy outside. But I think that's the exception. You know, it's cat's claw has good cross the board coverage for protozoa. Andrographis covers many microbes plus viruses. It's just the spectrum of coverage with a complementary set of herbs is quite broad,
Hmm.
quite broad.
Yeah.
Yeah.
Yeah, it's pretty amazing. So one of the things that I have observed in people that I've talked with and coached over the years is the significance of mold in the environment, and how that can really in many cases kind of hold back someone's improvement. And so I'm interested in what your thoughts are around, if someone's living in a moldy house and trying to get well from Lyme disease, how much does that impact us, and how common do you think that is?
It's common. It's more regional. In drier areas of the country, it seems to be much less of a problem. Here in the southeast, and especially as you move down toward Florida, it's a terrible problem. And I live in coastal North Carolina, and I would say probably most buildings over 10 years old have some mold in there. If you have sensitivity to mycotoxins and you live in that environment, you will not get well. It's as simple as that. And there are different approaches to mold. You can bring in professionals to do ozone therapy and different kinds of things. But if it's impregnated in the walls and it's up in the crawl spaces, you're going to have a heck of a time getting rid of it. You're going to have to make, in the short term, you do ozone and essential oil diffusions and things to knock the mycotoxins in your air and in your environment and help the filters as much as you can. But sooner or later, you're going to have to fix the big problem, or it's just going to keep coming back. And and that's a big one for a lot of people. It's a hard nut to crack.
I totally agree. And part of the challenge with it is it's one of those things that I think people don't explore. And most of the time when you have a mold issue, you don't always see visible signs. It's not like it's necessarily growing on the wall. So I agree with your comments, and I definitely encourage people listening to this, if you haven't done some testing in your environment to rule that out, I think it really sets you up to be much more successful and to have a much better outcome when you're doing all of these other restorative things, if you've taken that mold issue off the table. So please explore that. You have talked a lot today about Lyme disease. You mentioned that you had been diagnosed with fibromyalgia. I had actually been diagnosed with fibromyalgia as well prior to Lyme, and chronic fatigue and all those things. So maybe you can talk with us a little bit about how do these strategies work? Do they work for chronic fatigue syndrome, fibromyalgia, multiple sclerosis? What about conditions beyond Lyme, and how much do these things apply to those?
I think that same restorative foundation applies to virtually everything. And the more they dig, you can just pull hundreds of studies now of microbes, those stealth microbes, the low virulence microbes that are associated with chronic illness. Certainly, very good studies finding Borrelia and Alzheimer's plaques. the tie between multiple sclerosis and several microbes, chlamydia probably the biggest one, rheumatoid arthritis, and mycoplasma. I think the ties to these things are very, very real. And it's so that foundation, this concept of immune dysfunction with these microbes in the margins flourishing and causing illness is very applicable to many, many chronic disease processes. So when you look at that foundation, this concept of using herbal therapy and lifestyle changes and everything else is very good. It's an exceptional approach. And, you know, it's, I have so many patients that I've seen so many people over the years that they've gone to the specialist and it's like, well, they think I might have multiple sclerosis, but they're not sure because the testing isn't quite there. And I think they have this and that. And I tell them, hey, why don't you do this? Let's dig into this restorative approach and maybe we can get you well before they even find your diagnosis, you know? And so because the toxicity of these things are so low, not doing it is crazy. Everyone should be doing it. The reason that we have our diagnostic protocols is because we typically use heroic therapies to treat illness. And you need to know exactly what illness you're treating to match the drug to it so you don't kill somebody by treating them with the wrong drug for the wrong thing. So when you go beyond that concept of diagnosis and start looking at cause and apply your therapy to the causes instead of the process, it starts making more sense that you know, because all of these things, I mean, a healthy diet, herbal therapy, lifestyle changes, the chances of those having a negative effect are almost zero. So why would you not do those things? I mean, it makes total sense to apply them to everything.
Right.
And then when you look at fibromyalgia too, gosh, how many people out there with fibromyalgia actually have Borrelia in their system, but they tested negative because the testing for chronic conditions is just not very good.
Mm-hmm. Yeah, totally agree. And one of the things that's kind of concerned me is that, you know, you get someone who maybe gets a diagnosis of, let's say, MS, and their provider may then put them on steroids to minimize the symptoms. And the challenge then is if they do have these underlying chronic infections and you're kind of reducing their immune system's ability to respond, I often wonder if long-term we're not making the situation worse. So that's a interesting thought. Any final comments that you may want to share before we wrap up? Where can people find you? Where can we get the book?
Yeah, absolutely. Well, I'll close with one thought. One of my first patients, when I was figuring all this stuff out, I was in my primary care practice. This was before I knew I had Lyme disease, and I was putting together these concepts. I had a patient in a wheelchair with MS come to me, and I said, well, you know, none of these things are going to hurt you. Why don't you try them and see? And she tried the herbs, and this was before I really knew very much about herbs. And she tried the diet, and she tried all these different things. And within 6 months, she was walking with a cane instead of wheelchair bound. So, you know, the chance, really, these are things we all should be doing. Anyway, I did the medical system for many years, and I found that it was just a terrible environment to help people because you were pigeonholed into these little short periods of time, and it wasn't good enough to really give people what they needed to get well. So I started doing writing and ended up creating a company to produce herbal products. One of the problems with herbs out there is finding good quality. We're basing the foundation of our company on quality and honesty and integrity. So we're searching for the absolute best quality extracts. We're trying to put them in formulas that are easy to take and easy to utilize. We've been doing it for several years now. But I didn't feel like that was quite enough, so I built a program that we call the Restore program that I administer with emails. That people get an email every day or every other day for about 6 months. And it takes them through that whole restorative process. And in the beginning, it's a lot of it is just about taking supplements, what to expect, Hertzheimer reactions, and then we move people toward balancing their life, integrating reasonable exercise, getting them back into life, getting them back into community. A lot of it is written, but some of them are videos. And people really love that. It's worked really well. I'm getting ready to start on phase 4 of that to try to make it even better. And it's just something that we found that people really resonate with. And so the company is Vital Plan. And we have 2 websites. One is Vital Plan, one is Rawls MD. The reason for that is because the FDA won't allow me to use certain language in relation to products. I cannot use the word Lyme disease on our Vital Plan website. I cannot mention the word healing. I cannot say it promotes wellness. So it's written such that people have to read between the lines, which seems really odd that the herbs really do cure disease and the drugs just manage illness, but we can't tell anybody how good the herbs are. And I don't know, maybe that'll change one day, but it's sometimes frustrating. But we are there. We have wonderful customer service. I do consults for people, and I found that my role is much more valuable in talking to people around the country and helping them use resources at their disposal rather than them flying to me or setting up a practice such as in that way. So it works.
So that's fantastic. I had the opportunity to read a number of the emails and be part of those, the email course that's part of that Restore program. And I mean, personally, I find it very empowering that if people kind of, the more information they get from someone like you that's really an authority and understands this, the more you feel like you are not completely alone, and the more you feel empowered to get well. And so I think that's a great thing that you guys are doing. Maybe you can just repeat for us the website, if you're able to do that. I know you have a couple of websites out there. Do you want to share anything about those?
The primary website where you can find the supplements and the Restore program is vitalplan, vitalplan.com.
Okay.
And the secondary website that's just loaded with information to help our community of Lyme and fibromyalgia is rawlsmd.com.
Excellent, excellent. This was a very enlightening conversation. It's clear to me that that you have a fantastic understanding of Lyme disease. I appreciate your insights. I definitely thank you for taking the time to spend with me and to help others through this interview. Thank you for everything that you do, and I look forward to talking with you again very, very soon.
Sounds great. And Scott, thank you for the opportunity.
You're really welcome.
Excellent.